sphenoid muscle. And the muscles further in, these are the muscles that further in, and you can see their name. I mentioned to you the hyoid bone. This hyoid bone, usually if you strangulate somebody to kill that person, many times the person really strangulated. And when they hang a person, when I'm not teaching you to commit suicide, but usually the rope around the neck, if you fall off on the chair like that, this hyoid bone is broken, damaged. So in forensic medicine, they look at it, they touch it, that bone is broken. If it is not killed by hanging, it is killed by another person. Because you can never hold your neck like that and kill yourself. It's somebody else, so they know it is a murder. In forensic medicine. So that is the hyoid bone. This bone is a very interesting bone. This is the only bone in the whole body that is not attached to another bone. It is hanging this area of your throat because this bone allows your tongue to go forward and backward and to chew your food. That is the foundation of that gives your tongue the ability to move forward, backward, sideways, and things like that, and to allow you to swallow your food. Okay, without this muscle in there, and if this is broken, you have a hard time talking, you have a hard time swallowing, you have a hard time chewing. If that bone is injured or broken, okay. So these are the muscles at the back. Okay, these are the large muscles. You see, often we call the nuchal area. Sometimes you hold this area to release the tightness of the neck. This is what you do. And of course, you have the splenius capitis muscle. So these are the deeper muscles inside. So as I said, here again, you know what is causing that tightness over the neck and how deep you apply the pressure. Okay, when you give that movement and that massage. As I said, the purpose of all of this, how strong or how weak, is to reach the right muscle and to improve the circulation. Now, as I said, these muscles can become so tired that the circulation becomes poorer and poorer. So as I said, when the circulation becomes poorer and poorer, the lactic acid tends to build up. You know, so the waste product build up is so high that it will not allow the muscles to move. Okay, so when you improve the circulation, you move the waste product away. The toxic level goes down, and the muscle begins to work better and better. That's why the tightness will be gone. I'll show you some of these techniques that you can use. You can help people relieve that nagging muscle, nagging pain at the back of your head because of those muscles. And of course, long enough, it can affect the whole head. You know, a headache that will develop. So you go down to the chest now. These are the muscles that you can massage. For us men, it's easy to stimulate those muscles like people who have asthma. You know, people with asthma, for us men, it's easier because you can loosen these muscles like that. You know, it's quite fun. Of course, for you ladies, it's more difficult because the breast is hanging around there. And you cannot really do it, but you can still do it around it to loosen those muscles. Have you seen people doing like that for you? It's quite fun. You know, these are the muscles that you touch. It will help to loosen your respiratory muscles. We call that accessory respiratory muscles. We can do that. And then at the back also, there are the part of the muscles at the back. You can do like that. It is you can. There are. You see, massage has only how many moves that you know? Clockwise, clockwise. What is clockwise? Clockwise is like that movement. Right? Then you can do anti-clockwise, okay, or anti-clockwise. Then you can do across like that. Like that, you do across. You can also do up and down. Right? So these are just the 4 or 5 movements at the most when it comes to massage. You can do clockwise, anti-clockwise. You can do across. You can do up and down. Of course, if there are muscles like this, you can do oblique movement, which is like north-south. I mean, not north-south, southeast and southwest, like that. Go across. Because we have muscles that are going along that way. So what are you trying to do? Is to move the circulation, to move the blood that has been stagnant in there. Okay? And so when the blood supply is restored, those muscles should go back to work normally, unless it has been clogged for years, something like that. But you can still slowly improve the circulation, and the person will feel better and better. Especially people with chronic back pain and they have been taking medicines for so long, they have even gone for surgery and they fix the bones. What do you call that? They literally fix the bones, like L4, L5, L3. They can fix those 3 bones until you can't move those 3 bones anymore, and they depend on the rest of the other bones to move you. That is because of chronic conditions. But if we are early, we can reach that person. We will prevent that condition from going so far, so bad. Okay, these are the quotes from the Spirit of Prophecy. How do I get out of that? Okay? Yeah. Okay. You see that perfect health depends upon perfect circulation. Okay, this is not what we say. This is the kind of inspiration. The more active the circulation, the more free from obstructions and impurities will be the blood. So the blood nourishes the body. We know that. But sometimes we often talk more about this. The blood nourishes the body because it brings the nutrients to the body. All the vitamins, all the protein, all the chemistry of the blood that supplies those muscles and organs in order to work well, right? But I must not forget that the blood carries away the waste products. Now, if the blood is not fast enough to carry away the waste product, then the waste products will become toxic to those cells. You get what I mean? Yes or no? You know what I mean? Toxic, You know the word toxic, poisonous, to the cells. So very important that the blood will come to bring the nutrient, bring the oxygen. But during the metabolic process, you produce waste products. What are the waste products mainly? Carbon dioxide. If carbon dioxide is not moved away fast enough in the blood, it will make the blood acidic. You know, when the blood is acidic, it becomes toxic to the body. Okay, the other thing is, how about the other waste products like urea? And all the waste products from metabolism, they must be moved away fast enough too. Otherwise, that area will become toxic and not functioning well. So that's where you have aches, you have pains, you have tiredness, you have fatigue. What else? No strength, no energy. That's where you feel fun. Life is no fun anymore. That is where the circulation must be good enough, not only to bring the nutrition, the oxygen, but to take away the waste products. That's why some of these moves that I will show to you, demonstrate to you, is really meant to stimulate the circulation. As I said, if the circulation is good, many times the body will heal itself. Okay, we don't have to worry so much about it.
The better the blood circulation, the quicker the healing process.
Yeah, and the healing process is enhanced. Okay, so that every pulsation of the heart, the blood should be propelled to the extremities quickly and
Easy.
in order to have health. Okay, this is basic. This is cause and effect. Okay, they are related, closer than husband and wife. Okay, it's cause and effect. You cannot say no. If the circulation is not good, you and I are in trouble. No matter how young or how old I am. Whether you are a king or you are the queen, it does not make a difference. Okay, this is basic. So, the current of human life, that is the blood, right, is struggling to go its accustomed rounds and should not be hindered in its circuit through the body by the imperfect manner in which women clothe the limbs. That is, she was writing in May 1, 1872. That's why, our church has been given the knowledge more than 100 years ago. And what are we doing with it? Are we still as ignorant as before? When we already, the information has been written as early as 1872. Now it's 2024, whoa, more than 100 years ago. So that's why sometimes, who to blame? It's just because we were not listening, not reading, and not paying attention. So she wrote this under the topic of as a health reformer. So the clothing that in those days, those ladies, they wear those heavy clothing, They have loops and rings, so that their clothes are spread out. They look like a peacock when they walk around. You know a peacock? Yeah, but some of those clothing that those people wore before was damaging to the body. They wear rings and but nowadays too, I know some ladies, sorry, talking about you ladies, the body, they want a certain shape on the body, so what do they wear? Girdles and things like that. So they hide the fat somewhere and something like that, so that they will not look not so awkward or something like that. And they are tight. They really bind your body, and that causes compromise to the blood circulation. So just like us too. Okay, let's talk about the men now. Men can wear tight pants and underwear, tight underwear. And so one of the problems that we men face is infertility. Many women, the wives that they marry, they can produce, but the man, they don't have. They have a gun but no bullets to shoot. So you can't do anything. So and part of this is mentioned because they wear tight pants, and nature has it that the scrotum of the man is hanging below, and they are supposed to be free. Why are they below and outside the body? It's because it needs to be 1 to 2 degrees lower than the core body temperature. The core body temperature is 37, normal, unless you have fever. But the testis is 1 to 2 degrees lower, at least 1 degree lower. Okay? So it is outside. So the sperm cells produced that can survive. Any body temperature higher than 37 or capped at 37, they die. So that's why you find that a man has a gun, but no bullets. You know, you can fire pang, but you don't shoot anything at all. Nothing happens. And they are so discouraged, and so they need to do this and do that. So some of the best thing is literally, that's why now there are underwear, especially for men. So when you put on the underwear, the scrotum, where the testes are lifted like forward and not really touching the trunk of the body, so that the temperature can be maintained and not as high as the body temperature, because it will kill the sperm cells. Okay, that's the reason why the testes are hanging outside. Okay. That's a very important fact. Right? When God created it that way, and then we use underwear that's very tight, we pull up, and the testis is leaning against the abdomen, and the temperature is too high. So how can you make babies then? Because you kill the sperm cells. Okay, so this is important. Okay, that's why we encourage men. Okay, you boys, old enough. Right? When you go to sleep, you do not need an underwear. You just wear a pant that is quite loose. Because if you whole night, you're dead.
8 hours, 7 hours.
Yeah, 7 hours, 8 hours with a tight underwear. Nah. Look good ang tanan. So this is the thing I showed you. So you begin to see in our modern generation, because of our clothing.
Next question. Does it apply only to the younger ones, not to the old?
Also to the old.
No more.
Especially the old with young
I'm
ones.
not sure whether I should go a step further talking about this. Because I want to mention to you that they are what you call naturally born eunuchs. Eunuch, you know, eunuchs? Yeah. They cannot be a father. The reason some of these naturally born is that because, you see, we have, okay, you ladies bear with us men, okay. If this is tickling to you, then let it be. You see, just before we are born, last trimester, you know, the last 3 months before a baby is born, the last trimester is very important for a male baby. Because that is the time when the two testes will find their way down to the scrotum. So there are babies born where the testes do not go down to the scrotum. So we call them undescended testes. Okay? They are undescended. They must descend from the abdomen, up here in the abdomen, to go down to the scrotum. That is normal process, normal procedure for a man, for a male child. But should anything interrupt that process where the two testes find the way down to the scrotum, then the child may be born with one single testis if one made it down and the other did not. If two did not go down, they are born as eunuch. Okay? And if the two testes stay up here all the time, the worry today is cancer of the two testes. Because they are in the wrong
Position.
wrong place. Yeah, not only position. The position is left and right. But they are in the wrong place up there in the abdomen, and because they are in the high temperature, those two testes will undergo atrophy. You know what atrophy is like? They begin to like die. Atrophy, like your muscles you don't use, after some months they become smaller and smaller. That is what you call atrophy. So the testes become smaller and smaller, and in the end, they are useless testes. But because they are up here, it increases the risk of cancer. Cancer of the testis. So cancer of the testis is not so common when they are descended into the scrotum, but when they fail to descend. Okay, it's very important to descend. Now, usually in the army, we never forget that. Oftentimes the question is asked, there are two testes left and right. Which one go down first? You might guess, but you do not need to guess. When a soldier will forward march, which leg go first?
Right.
Left.
In the Philippines, you cannot forget that.
Left, man.
How about in pathfinding? When you tell people to march, what do you say?
Left, right.
The command is always by the left, forward, march. It's always by the left. So in anatomy and physiology, the left testis is the one that go down first, followed by the right one. That is the normal procedure. And how do you know you are right or wrong? As I said, you follow the army, you cannot be wrong because it's always left first. And the left testis is a little bit lower than the right because it descended first, so it occupies first position.
What if the right testis is lower? There's something wrong.
Mali na.
Then you're not following the rule.
What if
Now the left is normally lower. What is the reason for? They are not hanging together same level. The reason is for us men, if we close the legs suddenly and the two testes are at the same position, that's the position, right? Then they impact each other. And that can be very, very painful experience. So they are one a little bit higher than the other. So if you close your legs, then they slide on top of each other. And then you do not bang the walls.
Birok na.
God is wise. He has a reason for everything He creates. Okay? God is really awesome. He knows what He's doing. Otherwise, you play football. You kick to the from the left leg, you kick to the right. Nah. The two testes will bang each other. You forget about playing.
God is fearfully and wonderfully made.
Exactly. They give God the credit literally. So this simple thing is only again. So maybe you ladies are happier because you know the men a bit more now. So this is talking about circulation, very important, and where they are, the position or the position and the process itself. This is anatomy and physiology.
empty and wallet?
That is side knowledge. So do not wear tight clothing where it's not necessary. No? Okay. If you look at most of the animals, you look at the dog, where are the testes? There's the scrotum hanging outside. Do you see him run? You see the testes also.
All the animals.
The cows,
Carabaos.
goats. all of them.
Kurang tahu, bagugo.
Okay, God has a reason for that. Oh, sorry. Let me go to the next slide. Back, okay. Oh. Okay, now I mentioned to you about the muscles of the chest. These are what we call the accessory muscles of breathing. That's why, as I said, when a person has asthma, difficulty breathing, or a person has been lying down a long time, when they lie down a long time, many times the respiration becomes slower and slower. So when you give some treatment to the patient, you rub the muscles of the chest. You see here all the muscles here? As I said, there are only 4 movements. What can you do? Clockwise, anti-clockwise, across, up and down. When you do these 4 movements to all these muscles here that hold the ribs, they will feel very good. They can breathe better, easier to breathe. The lungs are more, like I said, more open, it gets more oxygen down to the lungs. Okay? You know, when a person is not breathing well, who else besides asthma? People with pneumonia. Okay? People who are coughing. You know? And as I said, people who have been lying down for a long time. You do that movement. You can do a vigorous one. It depends on how fast and how big your patients are, and how muscular they are. Sorry?
Depression.
Yeah. As I said, you can do it light to begin with. Always start with the superficial muscles. And then you can go down a bit more with the deeper pressure to reach the deeper muscles. Okay? You just do that. Right? They will benefit. Yeah, you can see the other muscles. Right? So these are the deeper muscles. You can reach the deeper muscles as well. Okay? Can you follow the ribs like that? You can follow the muscles are here, right? So you do not massage the bone, right?
Yes.
You go, as I said, in this one,
In between.
you need to go in between, right? Like that. Okay? Don't run against the bullseye. So you know where your ribs are, the last ribs here, right? You can go across. So you can turn the patient onto the side and you give them a good stir up, you know. Both the external muscles and the deeper muscles between the ribs. Okay. Sometimes you do that, you tickle them and make them laugh. They will be happier too. Okay, let's come to these abdominal muscles. These abdominal muscles are very important. These are the oblique muscles, and these are the rectus muscles, right? The rectus abdominis. They are what you call longitudinal. They are longitudinal. Right? These muscles are very important, especially for people who have backache. Now, I want to explain to you why people develop backache. This is not the only reason, but most of the time, this is the most important one. I think this is too loud.
Too loud.
Yeah. Maybe just turn it down lower. A lot of resonance. Sorry about that. Now, why does a person develop backache? Because of wrong position, because of too much, overaction. No, not overaction. Too much emphasis. Yeah. Okay. But most of the time, it is because we overuse those muscles. When we overuse those muscles, the blood supply is insufficient. So the amount of oxygen going in there is not there. The metabolic rate slows down. And the blood supply, the venous supply moving the waste products away slows down. So because of that, the muscles develop fatigue. F-A-T-I-G-U-E, fatigue. Those muscles will cramp, those muscles will shorten by contraction. And when the muscles contract long and do not release fast enough, those muscles will become more and more tired. More and more lactic acid will build up. More and more waste products will build up. And there, you cannot avoid back pain. So, the main problem is because we overuse those muscles. I don't mind. Why are you forced to overuse those muscles in the back? It's because many times the abdominal muscles are too weak. You see these muscles, these abdominal muscles in front and the muscles at the back, they cooperate with each other to keep our body upright. So many times when we do work, our position is like this. So you are always using these muscles, and these muscles do not contract and relax, in order to have good blood supply. So when you are like that, there are certain muscles that hold tight so that your position, you can keep your position. Certain position you are sitting or you are bending, whether you wash dishes, you wash clothes, you do ironing, all these things that people sitting in the office are not good. But sometimes you have a table where you can rest your arm too. So, but you are still using the muscles on the back. For hours you are using that. And then you do not straighten yourself, you do not relax, and things like that. So in the end, you overuse those muscles and they develop fatigue. And fatigue will go into spasm. You know the word spasm, right? They contract and will not let go. They contract and not let go. So that is the main cause of back pain. So what do you need to do? So that the two sets of muscles in front and at the back, these two sets of muscles, we must use and have them strong enough to support each other. It's just like husband and wife. You are complementary, not to criticize each other and to quarrel, but you complement each other. Oh, if I wake up late, you wake up early. In other words.
Not always.
But we are supposed to complement each other. So instead of over depending on these muscles at the back, you strengthen your abdominal muscles. When you strengthen these abdominal muscles, then they can balance each other. So you will not over depend on the muscles at the back, because you can have support from the abdominal muscles. Okay? So there are exercises that we must do if you have back pain. And that exercise is that you must strengthen your abdominal muscles. Okay? You cannot say, I don't want to do it. If you don't want to do it, then you enjoy your back pain. No choice. You want to go and see a doctor, give him your money, that's up to you. Okay? And if you want to take those medicines, which in the long run can injure your stomach, can injure your kidney, and can also injure your liver. Because all those painkillers, they have to be processed by the liver and the kidney. And if you overload those two organs, then you pay a price in it. Right? So I will talk about this exercises, talk about afterwards. Okay. And sciatic pain, you see that I will also illustrate that. So you find that you ladies, you also have those muscles, right? Okay? The inside is called the linear alba. But when you become pregnant or become fat, you find that the linear alba will become much stretched. And sometimes you also have what you call stretch marks. Yeah, because of your large abdomen. And there are people who are fat enough with a large abdomen. Men also can have stretch marks. Okay. But anyway, those are the important muscles. Oh, that's it. Sorry. Okay.
What's the cost of diastasis?
This is what you call diastasis. Where the linear alba is very much this is anatomical and not pathological. Anatomical, physiological, but not pathological. This is not a disease. But usually the problem is that if we develop large abdomens, it's because the abdominis muscle is weak. We are not using enough of it. Okay, I will show you the exercises are very important. Actually, all of us, men and women, we should actually do that. Actually, we should do some of that before we get out of bed. When you wake up, you can say, Lord, thank you, I'm still alive. And after that, you do some of these exercises before you get out of bed, so that you will prevent low back pain, especially. So these are the muscles in the back. As I said, why I show you this is so that when you do massage, you know which muscle you are going for. You know, this is longitudinal. So your movement is like that. Right? You follow the muscle. Right? You can go across like that, right? You can go clockwise like that. You can also do anti-clockwise like that. So, which part of the muscle? Which part of the back? And what muscle are you touching? What muscle are you treating? Okay, you have an idea. So all your movement, you have a reason to it. Okay. So that is especially for massage. Okay. But as I said, for treatment of pain and so on, they are related to this. Okay. So you see what you can do. So for example, the person comes to you and says, "Oh, you massaged me last week. Today, my discomfort is not relieved yet. You know, every day is still the same." So you think of another one. Did you touch the right muscles or not? When you massage the same person again, then you ask yourself, did I touch the right muscles that he was complaining about? So you think over, right? As I said, when you know anatomy a little bit, you know what you have done and what you have not done. So do not do the same thing again, right? Because the first one already did not work. So the second one, you better think, right? What did I not do? So you can help that person more objectively. More objectively. Okay? So those are these muscles, right? And the gluteus maximus muscle. This is from top to bottom. All the neck muscles. Okay. As I said, they go different directions. They need your attention. Okay, I'll read some of this here because, okay, I want to read this one. It says the nerves control the circulation of the blood. That's why, as I said, I show you a picture of the nerves a while ago. It said, for instance, you are impressed that if you bathe, you will become chilly. The brain sends its intelligence to the nerves of the body, and the blood vessel, held in obedience to your will, cannot perform the office and cause a reaction after the bath. So this is one example that Ellen White wrote about what we think. Have you heard that expression? What a man thinks, so is he. Have you heard that expression? As a man thinks, right, so is he. So there are a lot of things sometimes out of fear. The thing that you fear exactly happens. Okay, just let me talk about this a little bit. I know in the Philippines this is critical sometimes. Should you take a bath before you go to sleep?
Yes.
Or you take a bath when you wake up in the morning?
Yes.
Which one you think is
Same.
more necessary or more important?
What is the idea?
Like during the day, you know, for at least for me, during the day I exercise, I work, I go under the sun, I sweat, things like that. So do I put on my pajamas and jump into bed without taking a bath?
In the morning exercise.
So this is the question that I want to leave it to you. Which one do you think is important? Between taking a bath in the morning after you wake up and before going to bed, or at least in the evening, after you work and things like that, you sweat and things like that. You know, you're outside exposed to the dust, chemicals and everything. Okay? If you were going to ask me, as far as I know health is concerned and medically, It's better to clean yourself out of the dust and the chemicals that settle in your skin, those that settle in your nose, and you brush your teeth, you gargle your throat before you go to bed, because you are clean. And to make things also more related is, I do not wash my bedsheet every day. I do not wash my blanket every day. I do not wash my pillowcase every day. Hopefully weekly. Otherwise it's monthly, for some people. So that is very important, right? So because if I did not take a bath, I jump into bed, I will dirty my blanket, I will dirty my bedsheet, my pillowcase, everything. So to me it is important, medically, for you to be clean before you go to bed, because you do not clean your bed sheets and your blankets every day. You don't change them every day unless you have hotel service. So to me it is important at the end of the day, whether you have a warm bath, right there in the Philippines it's so hot sometimes, or take a shower and you clean yourself before you jump into bed. Clean your nose. You have 2 small fingers, you clean your nose. Because at the end of the day, a lot of dust, especially those of you who travel through the city, you can collect a lot of dust in your nose. So before you sleep, you use the 2 fingers to wet them in the water, and use the 2 fingers, whether one by one or two at a time. You soften everything, the dust collection, and then you do it once, twice, or 3 times, and then you blow it out. So your nose will be clean before you go to bed. And that's why you brush your teeth or you gargle the throat, you wash away the dust, reduce the bacteria, the virus together in your mouth. That's why you brush your teeth. I know some people say, why do you brush your teeth? It's not to keep it clean. If they say, I sharpen my teeth for the next meal. That's not as important, but it's really to reduce the bacterial count in your mouth. That's why you do that. So you take a bath with warm water, with soap, whatever it is, you reduce the bacterial count. That's the thing. Because the bacteria or virus are enough, they can make us catch sickness, disease. So that is why. So if you want to take a bath in the morning to freshen you, okay. But I think it's very important before you jump into bed is to be clean. Okay? Especially you sleep close to somebody. Okay? Otherwise the baho is too strong. Okay, so I want to leave this one. So this is the one that we will do. Okay. So what is the time now? Okay. Can I start talking to you about the exercises first? Which one do you prefer?
What about praying?
Yeah. So this is the program that I follow through when I'm in the center. And also for the health guests to come, they want to learn, I will spend time talking to them. Because some of them only come once, some of them they can afford to come back again, and things like that. So hopefully, by the time they go home, they know what to do. Because we are not doctors like outside. When you are sick, come back again. When the pain comes back, you come back and see us. But we want them to go home with a better lifestyle and to be able to take care of themselves. We are not after the money. We are after the health. That's the important thing. Okay, we exist as a center not to enrich ourselves, but we want them to go home with better health and a better understanding, and they can take care of themselves better. And when they go home, they're able to share the knowledge with the family members or with colleagues and friends and people around them. Okay, so this is the first part of it. I already give you a bird's eye view of what you what the human body is like and what you need to do, what you can do. Okay. So any questions so far?
Sir, Doc?
People often tell me, if there is no question, it means the people are not listening.
Question that question.
So you've been talking to the chairs, talking at the wall.
There's a question, Doc.
Yeah, if they are listening, they usually have reactions and questions and things like that. Okay, it's not to give the speaker a hard time, but to clarify things like that. Yes, ma'am.
Doc, regarding sa Scrum, if I Scrum, what we do? I mean, during we swimming, what we do?
Okay, if you are swimming, that's the first. If you are swimming, so that you can only depend on your hands, to keep yourself afloat. If you can call for help, then you need to call for help. Because if you cannot struggle to the wall of the swimming pool, things like that, then you might go down.
Yes.
So,
Help.
yeah, when you can raise your hand and say, I need help, please help, I have cramp or something like that. If you can still talk, yeah, before it becomes so bad. But if in the water, you can't do anything for yourself. You can't sink down to the bottom and try to pull your leg, something like that. Yeah. If it is shallow water, one leg can be on the bottom of the. You can do something. Yeah. But if you is in deep water, you cannot. You need to call for help.
Because I didn't experience about that. Yes. It's very,
What will you do? What did you do?
I need help.
Yeah.
You
That's
need
right.
help. Yeah, you need outside help, not yourself.
That's right.
Or if there is a guard, then you need to get help. The one that I see in Malaysia recently, I went with my son to what do you call it, like a recreational center, where they drop you from something like 50, 60 feet, zoom, and then down, and it's on the chute, then you will come out flying, and you land in the water. Now there are guards there. If somebody is doing it, you must inform them, and the guard is waiting. Because there are some people, when they come down, out of fear or anxiety, whatever it is, the muscles can cramp. Not to say because of overtiredness. And when they get down to the water, some of them lose consciousness because of the sudden drop from 60 feet, 70 feet, zoom, and then down. And then you end up in the chute and then you fly off like that. So these guards, they do not go just by swimming. They carry what do you call it? Like a foam. It's like a foam. They can actually put the whole body on top of it and not sink. So they will jump in right immediately with that, and they can put that underneath you and let you float. Yeah, they are to me, that is a very good technique. Before, I see lifeguards without any help, just bare hands. So now they are safer. They use that kind of method now. So especially in water, if you are known experience cramps like that, then you'll be extra careful. Never go alone. Yes, sir.
Maligo po.
Yes.
The cramping is related sometimes to consumption of either food
Yes.
or drink.
The electrolytes.
So, can you explain that?
Yeah. You see, the electrolytes are very important for your nervous function. Calcium, potassium, sodium. If any three of these is lacking, you can experience muscle cramps. So I know in the Philippines you have Gatorade. Right? Gatorade is a electrolyte drink. So if you are exercising and you have been sweating a lot, make sure you still have enough electrolytes in your body.
This Gatorade.
Gatorade can be of help. In Malaysia, we have 100 plus. I think besides that, I think you have sports and sponsor and things like that. Those names, they are the ones that can help you. Or else, when you drink your water, you put a piece of salt.
Curry water. Curry water.
Sorry?
Curry.
Curry water.
Very sweet.
Curry sweet. Sweet.
Like you work in a farm and things like that. Do not go beyond two bottles or 2 cans of that. Two tins of that. You may need one. So let me go back a little bit further than that. For example, if you are a person who sweats a lot, you drink plenty of water, and then your shirt gets wet, your pants get wet, and your shoes get wet, or your boots get flooded, that means you are sweating a lot. These are the people who tend to develop cramps more than others. So let me give you a simple guide. Okay? The simple guide is this. The simple guide is this. Your sweat is normally salty. When it comes to your eyes, sometimes you can feel the salt. And when it comes to your mouth, you can feel the salt. But the moment when your sweat is not salty anymore,
It's dangerous.
then you are coming to the point where an electrolyte imbalance is right there. So when you do like that, kapan takkan kayu ba? Oh, then you know your electrolyte is already low. Okay, that is the kind of test you do not need to go to the hospital or go to a lab to see whether you have electrolyte imbalance. You just so then you need to put some salt onto your water. Otherwise, you can dehydrate. Because the reason why sodium is so important is not only as electrolyte for our nerves to work well, to function well. But when the sodium is too low, that our body cells cannot imbibe water. So all the water that you drink can just go out to cool your body. And that is the time when your sweat will become tasteless. That's the time it will become tasteless. So when it becomes tasteless, that's a warning to you already. Yes, sir.
That's a very good information because that is my case. I sweat a lot, especially if it's really hot. And when you lose sodium also, it makes you weaker. And it makes your cognition tired and your cognition low. Also for like for the elder, that their sodium goes down, they become confused.
Yes.
So
The nervous function.
even though I drink a lot of water, it doesn't really help. It doesn't really get out the tiredness. But because my neighbor here, they have like coconut, I just get their coconut. It really rejuvenates my strength. I cannot explain it, but it gives me like that energy. It's like it energizes me. And I believe the coconut water is better than Gatorade.
That's the natural source. So just remember that, okay, because it is necessary. If you have no salt anywhere, the coconut water will be good. But just one word on that. Coconut water is also a diuretic, or you call it a diuretic. So it increases the flow of urine. So in the end, you need that sodium to get back to your body, so that your cells can hold on to the water. Otherwise, all the water will go out. All the water will go out. That's why I experience it very much myself. When I sweat, when I walk outside, because I'm a country boy, I'm not a city boy, I work like you can work in the farm, I can work in the farm. I will sweat so much that my pants will be wet, my socks wet, and my sweat is collecting in my boots. You know those kind of boots? The long boots? I can hear, it's just like, when I walk, it's like fish inside my boots, you know, you hear the water inside. So, when I go out like that, in my bottle, I put some salt. Or else, I run out of sodium in my body. Because sodium is very important, because sodium is a large molecule. And water molecules are smaller. So if there is no sodium, not enough sodium in the body cells, what they call the intracellular fluid. Anyway, because it has to do with osmosis and things like that. If there is insufficient salt, no matter how much water you drink, your cells cannot hold the water. And to keep the cells, the osmotic pressure of the cell intact. That's the problem. So you can drink a lot of water and still be dehydrated because of salt, lacking of minerals. Okay, keep that in mind because a lot of people do not buy. As I say, if you drink coconut water because it has the other electrolytes, it will help to rejuvenate the body, to restore the water, the electrolytes in the body. But that fellow is also a diuretic. It will help you to diuretic. It will increase the urine flow.
What I've noticed also when you sweat a lot, like for me, I have a hard time peeing also, and it's really concentrated.
Yeah.
Right. So that's really painful as well.
Right. So that's a good one. You know, when you pee, look at your urine. Especially for us men, it comes out in front. You should see it. But for you ladies, sometimes you can't see it. You know, like I talk to many patients. I say, "What's the color of your urine?" He said, "Doc, I did not see." Why? The toilet is too dark. No lights or something like that. And because it's mixed with the water in the bowl, so you can't tell. But if the more yellow your urine, the more concentrated usually. And if you pass out urine and the amount is little and the color is so yellowish, almost like
Like a
pea
chalk.
color they call it, then it is an indication that your body is lacking water.
You're
So
dehydrated.
the color of your urine tells you how much you need to drink. Do not ignore that. Okay? Why we ask you to look at the urine is to tell the color, so that you know how much water you need. What is the best color of urine?
Ay, dili po. Dili
Someone
po
would say
color
colorless,
Dili
like
po.
water in other words. Healthy urine can be light yellow, pale yellow, or we call straw color. Sometimes straw color in our tropical countries, your water level is already quite low in the body. You know the color of straw is almost like the color of this board behind. So make sure you do not tell people that my urine is white. If your urine is white, then you might be from Mars and Jupiter and not from planet Earth. It cannot be white. Yeah. So you say the urine is colorless. Then you have sufficient water. Okay. That is good for that. Okay. So that is question. Yes.
Which water is good to use when you're taking a bath? Warm or cold?
If you have tired muscles and things like that, a warm bath is good because it improves your circulation. But if you use cold water and the evening becomes colder, then low back pain, sciatica, this kind of a pain, and leg cramps is going to be more common. So if you have no money to buy a car, you have enough money to buy a heater if you can, a water heater. Yeah, especially as you and I grow older and older, warm bath is more important than a cold one.
Also in the morning,
Yeah.
can we cold or after
How do you feel the temperature around you?
cold in
It's
the
cold.
morning?
You can use a warm,
Even in the morning,
yeah, or
even in
lukewarm.
the morning,
Yeah,
we can use the warm water.
yes, you still can. Unless if you use quite hot, okay, then you end up, you turn off the hot, then you just go to the normal water and finish up like that.
Yes.
Okay, with not a cold water. That one you use for treatment, but just the normal water. If you turn off the heater and let the water run for a while, and you go in and come out before you dry yourself. Yes.
Like in the morning, it says
If you are in the booking, it's over here.
because the colder is much better because it wakes you up and it's good for your nerves. But at night, the other reason to use the warm water because it prepares you to relax your muscle and to go to sleep. That's why there's no use of using cold water at night because it's just gonna keep you awake. Not like during the morning when you're ready to get up and
To stimulate yourself.
Yeah, to be active on your work. Cold water is it's advisable even in the spring of process because of that nerve impact on your body.
Yeah.
Because it also tightens your muscles and it also on your nerve and everything to prepare you for the next day. And also to cleanse you from all the waste money that you
Okay. Yeah, I understand that kind of explanation, and it depends also whether you live in a hot country like the Philippines, or you are living in America facing winter, or Australia, things like that. So those are the factors. Okay? But for most people out here in the tropics, taking a cold water bath, unless the air around you is so hot, that cold water bath, especially for older people whose circulation is not as vigorous anymore. Cold water bath, very difficult for them to accept, to what do you call that? To restore the equilibrium of how the body reacts to hot and cold. So in control conditions, most people will take a slightly, not to say hot, but just warm enough. It is not even as high as the body temperature. It may be only like 25 degrees. Instead of 37 degrees body temperature, it may be only 35 or even 34. That is, you do not need to go as high as the body temperature. It's like a warm water bath. Because in our treatment, in our center, we use the hot and cold very distinctly for people what the conditions they face. We will not, what do you call that, consistently use only one. So that is to stimulate the circulation. Because when you take a bath and things like that, you always try to reduce the whatever pathogens on the surface of the skin or dirt, anything like that on the surface of the skin. That's why a good rub down when you take a bath, whether it's warm or cold. But usually cold, we do not use it for long. When you're after taking a hot bath, we can use as cold as ice water. Ice water meaning ice in the water. We pour it over the person in one go. Rinse. Yeah. And then that is to help the body reduce the high temperature to its normal body temperature. And that is really therapeutic. But if you cold water, how long do you stay in the cold water, or how long does the cold water is allowed to affect you? Is a question. More difficult to control than warm water or hot water. Okay. Yes, ma'am.
No, Doc, additional lang regarding sa hot I really experienced since December. I use a hat during night. I really experienced the good sleep and no more back pain. Yes, Doc, I really experienced that. Before I
Take cold shower.
shower a cold, I have, di ko katulog.
Kaya gipanuhot.
Panood. But now, I really experience, ay the best ang hat talaga paggabi.
Dili kay hotel.
Hat, dili kay hat, tama-tama lang.
Warm.
Yeah, warm lang, warm. So, I really buy a hat. Anytime
heater,
I
heater.
cold.
Heater.
Yun siya.
Even the sinus and things like that.
I would say that.
I have a daughter, Doc, sinusitis, what you call this. Every morning, they experience
Sneezing.
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 What we do?
What can we do?
What we do like that?
Sometimes, the Bible says, what is
Sayaw mo lang
the
ako.
body of man, you cut it off. Anyway, I'm just joking. Yeah,
Kasi
sometimes.
tambal niya doon. Kasi maayo para sa iya ha.
So you want to find out what is causing it. Is there a sinus problem? Is there the bridge of the nose, whether it is too low or because it is already crooked inside? And we need to look at the sinus area of the nose. You know, is there if you can rule out there is no growth, no, you know what I mean, growth, something growing in there, whether there are polyps
Oh, yes.
or whether it is
Oh, yes. Oh.
tumor, anything in that area. If there is none, then we can safely resort to using hot and cold and things like that. And like as I said, cleaning out the nose and things like that. And also very important, I don't know you ladies because you do not have the hair in your nose growing too long and too big and too rough. For us men, sometimes we have problems because the nose, the hair grows from both sides. They cross each other and they fight each other. And so when you wake up in the morning, you know, your nails expand and you breathe more quickly. That's the time when they irritate. So that's why many of us, there comes a time when you use a small pair of scissors and remove some of those hairs so that they do not cross each other and what you call it, they poke the sides of your nose and you will sneeze for sure. So one of those things is to clear the hair that is irritating you in there. And of course, cold air causes contraction and that can cause a person to sneeze too. I do not know about you, but if you go out and look at the sun, a certain time of the day you look at the sun and then you are forced to sneeze. So there are certain factors. You try to find out what is the factor or what is the cause of that sneezing that can bring about that sneezing.
What about
Allergy of dog.
Whether allergy from dust in the house, fur from cats and dogs, or dropping of birds, or dust from the street. There are so many.
No, the medical says.
The other thing is our pillow.
Pillow, yeah.
You change the pillowcase.
Change the pillowcase or change the pillow.
Or change the pillow.
Or change the person. Yeah, you need to think of that. Whether your pillow is too old and the fibers are breaking to be so short, and when you sleep, it can get into your nose, right? And when you wake up, when you breathe more vigorously, it's going to irritate your nose if you sneeze. I have seen some people when they sneeze successively. Why would a person sneeze? That is a reflex action, right? Because it is responding to some irritation in the nose. As I said, whether it's the hair, dust dust particles, or just light, temperature of the air, all of this can cause a person to sneeze. So what you want to try out, you need to try to find out is what is the cause. What is the source or the cause? And then from there you work on it. That's why I emphasize before you go to sleep, you clean up your nose. Clean it up. It doesn't cost you a lot. You do not need a cotton bud, you know. As I said, God in His goodness, He has given us 2 small fingers. You put your finger into the water, wet it, and then you go in, you soften everything around there. Okay? Then put it back in the water for 3 times, to 2 to 3 times. You soften everything, then you blow it up. You blow it up. Then your nose is clean. So before you sleep, you do that. And hopefully your bedroom, the air in your bedroom is clean enough so that you don't have the disturbing dust particles and things like that. You have 2 fingers, these are very good. Big enough. Because you want to use your thumb, that is your problem. Can tap it on kayo.
The thumb?
You know, not so
It
well.
depends on the level of your nose.
Okay, I think I want to talk to you about the exercises to demonstrate to you. I will start from the head. Okay. Now this exercise is for the jaw and the mouth. Now they tell us that when you wake up, you exercise your tongue. How can you exercise your tongue? You can put your tongue out straight forward. You can put your tongue to my right. I can put my tongue to my left. I can use my tongue to push against the roof of my mouth, and I can bend my tongue down to push forward where my front teeth, my lower jaw, front teeth is. Okay? And you can also use your tongue to push your cheek, left and right. Can you try to do that? Right? You can push your tongue forward like that. You really push it out. Use strength to push it until you can feel the tightness of your tongue. Not just like that. Right? It's not effective. The exercise out, really out.
Pinakataas.
Right? You can push a minimum 5 times. Push 5 times. When you finish pushing, you can feel that like a little pain, something like that, to that. So the other one is you push to the side.